wickedly that Africa simply cannot, should not, and will not wait for others to do for us what we must do for ourselves. In this spirit, no one should work harder for Africa than Africans. Certainly, none should lead us to where we want to go than ourselves. This consciousness must continue to be the cornerstone for the outcomes of this conference and future conferences. From producing our own vaccines to developing immunological surveillance networks, and from constructing new public health institutions to pursuing Africa's leadership in global health diplomacy. Admittedly, many things have changed for the better in the last years. However, and despite our best efforts, 1 million black persons die on the African continent annually. This is 50% in their first day and 75% in their last week. 18 countries in the African region are amongst the 30 high population countries in the world. 230 million cases of malaria and almost 600,000 malaria-related deaths were reported in Africa, representing 94% of the global malaria case burden. 7.6 million children in Africa missed out on vaccinations in 2021, and a further 11 children were under-immunized, accounting for 40% of under-immunized and missed children globally. And in 2022, more than 116 million people are reported to estimated with mental health conditions before the pandemic, with suicide reportedly higher on the African continent than the global average. A kid missing a vaccine, a mother losing a child during birth, a person getting infected with HIV, and a sick parent being taken over long distances to medical facilities, another thing of the past. These are reminders that our health systems are not strong enough, are not equitable enough, are not accessible enough, and are not efficient enough. I know this room does not need me to inform about this, but this too is the size of the challenge. The task ahead is anything but easy. You need at a time of increasing need to consider the long and difficult road to health security on our continent. Each of you represent the hopes of millions across our continent. We hope that we can travel that difficult road successfully. As you consider the future, please ask ourselves, who will carry the public health flag of tomorrow? What should healthcare look like in 10 years, in 20 years? Who will be staffing our clinics and hospitals? From politics to education, are we preparing our countries, including digitally, to be ready to build upon and maximize the impact of treatments and technologies we see in other regions? Research, science, and public health. We are all aware of the brain drain, the immigration of highly trained workers from our countries to others. In Nigeria, in the past 6 years, 75,000 nurses have left the country. In 2022, Ghana has 4,000 nurses leaving the country. In Liberia, for instance, we are seeing a worrying shift away from the study of and required investments in science and medicine. Repositioning Africa is enabling our institutions of learning to stand up as they should with a new embrace of research in science and public health. By 2030, Africa will face a shortage of 6 million parallel advantage in responsibility to spearhead the of healthcare story. History is calling upon us. Developing the needed capital must be handling with the resources that will be required. For example, at the community level, community health workers, most of whom are women, and require additional training to provide much needed life-saving services, have done so for years with passion and determination. Nonetheless, we keep hearing how inadequate they are for their services and their lack of career advancement opportunities. Here, too, succinctly, we cannot successfully reposition Africa if we cannot support community health workers. It is that basic. President Sirleaf is proud to be working alongside Director General Dr. Jean CPHIA on the Africa Frontline First Initiative to develop a professional network of 200,000 community health workers that are skilled, supervised, salaried, and supplied. Thank you, Dr. CPHIA and team, for your steadfast leadership. I asked a young lady what she thought the future for health should look like. Her answer was profoundly revealing. She said, hopefully, we will see our political leaders who have responsibility to deliver high quality of services, traveling outside our countries and even outside the continent for checkup and treatment. In any case, as the COVID-19 pandemic has shown, by the time we respond to an outbreak, it is already too late. In our discussions for the future, prevention and rapid detection need to be at the core of our planning. This leads me to my next point. Inevitably, the future will be shaped by threats to climate change, migration, and non-communicable diseases. Therefore, we must foresee the needs and develop the capabilities to adapt to that changing landscape. To change the paradigm of disease and neglect we see in many of our countries, we must change our own perspectives. For instance, we should not continue to wait for patients to come to us with illness. We must go to the patients. We must find them, including to the very last mile. Repositioning Africa is taking health services to the doors of the sick. We can afford to do this because we are not incontinent, although it is fair to say, as that young lady suggested, we have been managed poorly. Finally, the change we want to see must come at a pace and speed. This requires a recognition of the inevitable. Politics is nothing else but health at a larger scale. We lose the initiative if we believe we can continue to shy away from engaging in politics, even the political aspects of health. Contrary to the popular view of scientists, many of you in this hall, it is not a lesser activity that ought not to seriously concern us. Politics determine allocation of resources. Improving health requires resources. Politics, especially health politics, require our experience in meetings, hearings, parliamentary discussions, and other activities that will form the national direction we ought to follow and the allocation of the resources we will need to get there. Therefore, I invite you to take away the negative connotation around politics and become a champion for your cause, to improve health conditions with your government. If you don't get actively involved in making the decisions around the political prioritization of health, others with less incentives and knowledge will occupy your space and continue to decide for you. Let me use a reminder of the four aspects I believe can be the foundation for transformative change. Firstly, to be a health workforce powerhouse, we must invest in building a human capital pipeline. Secondly, public health must become an inclusive culture that permeates all of our institutions and activities rather than just a disconnected refuge for scientists. We must think about public health in the context of a whole of society approach, a duty shared from the cradle to the grave, so that we may well be our enduring legacy. Thirdly, we must strengthen without compromise African agency. We must continue to demand of ourselves higher standards of leadership and accountability. With this spirit, I encourage each of you to be advocates and champions of your communities, your districts, and your country. We must live and breathe the freedom to dictate and determine our future. This means we must not just pray that Africa be positioned to ensure and sustain Africa's readiness. Lastly, and of no less importance, to accomplish the vision of the new public health order, we require leadership that is committed to making health for all a reality. We must champion health security in our politics and encourage others to join. It befits the moment, therefore. She represents the land where half a century ago, future Zambia's independence. Africans gathered to deliberate, to convene, to rally. They said to themselves and said to the world, this is our land. This is our people to care for. This is our future to shape. This is our destiny to own. Today, as we gather again in the halls of Mulungushi, let us relive the spirit of Mulungushi. Let us reclaim the call of Mulungushi, and let us act for better health care. Let us therefore declare the decade for health. Your Excellencies, honorable ministers, distinguished ladies and gentlemen, let us make the third International Conference on Public Health in Africa a historical milestone for what is possible with health in Africa. Let us renew our efforts to radically, purposefully, and determinedly reposition Africa as a global powerhouse in health, well-being, and security. Many lives, including the lives of all of us in this room, depend on it. God bless you. I thank you.
Thank you very much, Ambassador Brown. I'd like to invite Mr. Smear Greg Johnson to speak next, who is the Director of Human Capital and Institutional Development at Auda Mech. Thank you very much. Please join us.
Thank you very much. And indeed, Ambassador Brown, it's our decade, and we're going to push through and declare this decade as the decade for health. I will definitely do that. Honorary ministers here present, Director General of Africa CDC, representatives from the AU member states, representatives from regional economic communities, representatives of the UN Family Development Partners, members of the civil society, representatives of the private sector, distinguished guests, ladies and gentlemen. I bring greetings from our African Union Development Agency and from our CEO, including the present here, Madam Nados Bekele Thomas. Of course, we join Ambassador Brown in pushing for this century, this decade rather, being declared as the decade for health. So we're very proud to stand before you to address the critical theme of leadership and its profound impact on the health landscape of our beloved continent. The African Union Agenda 2063 recognizes the key role of leadership as a driver of the continent's socio-economic development. Very proud, for instance, of the first 10-year implementation plan of Agenda 2063, targeted capable institutions and transformative leadership to drive the continent's development agenda. This priority remains pivotal as we move into the second decade of Agenda 2063. Ladies and gentlemen, we cannot talk about transforming the health of the people of our continent if we do not build the right leadership at different levels. To lead the agenda, setting through solid policies, to lead the transformation of the policies and the transformative actions, to mobilize and allocate resources where it matters, and to ensure there is accountability to commitments made. Leadership to us is not merely a position, but a commitment to shaping the future of Africa through strategic initiatives. And recent times have proven us that there are ample opportunities to demonstrate the essence of leadership in the face of challenges. I want to take a few minutes to reflect on how our heads of state have shown true leadership in shaping the health landscape of the continent. For instance, in 2021, when the continent was challenged with the HIV/AIDS pandemic, the AU Special Summit on HIV/AIDS, tuberculosis, and other related infections convened in Abuja in April of that year, and adopted a declaration that committed the member states to respond collectively to the challenge. In a Abuja declaration, the heads of state committed themselves to take personal responsibility and provide leadership is exercised in the area of responsibility. In addition, there was a commitment to allocate 15% to the health sector, highest level. However, we need to continuously ask how we are transforming this commitment into action. To date, only a few countries have delivered the 15% of national budget goes to the health sector. Ladies and gentlemen, on a positive note, recently, as we navigated the complexities of the global COVID-19 pandemic, the African Union showcased how collective leadership is of paramount importance on issues that impact the health security of the continent. The African continent was the first to adopt a continental strategy and approach to the fight against the pandemic. Under the leadership of the President of the Republic of South Africa, His Excellency Cyril Ramaphosa, as the chair of the AU champion on COVID-19, and the continent has seen transformative and sustainable steps being taken. These include: 1, the Africa Task Force for the coronavirus; 2, the African Medical Supplies Platform; 3, the COVID-19 Africa Vaccine Acquisition Task Force; and 3 and 4, the new public health order as a mechanism of providing direction on Africa's health security agenda. The African Union Development Agency has been unwavering in its support of our esteemed heads of state in crafting and executing effective actions around these set priorities. The collaboration between the African Union Commission, and the Africa CDC has shown the power of unified efforts in mitigating the impact of the pandemic on our people. Our commitment to health extends beyond crisis response, as demonstrated by impactful work in addressing HIV/AIDS, TB, and malaria. Over the years, we have led programs supporting rights and member states in the fight against HIV/AIDS and TB among vulnerable populations as part of fortifying the EU commitments to achieving self-sufficiency and reliance of our healthcare systems. We are leading the implementation of the pharmaceutical manufacturing plan for Africa in conjunction with the P1. Our African Medicines Regulatory Harmonization Initiative has driven efforts in creating an environment for regulatory provisioning and protection and trade in medicines products. Moreover, the AMRH initiative has proven as a solid foundation for the establishment of soon to be established the African Medicines Agency. The African Union Development Agency remains at the forefront of supporting the implementation of African Leadership Meeting, ALM, on domestic financing for health championing by the President of the Republic of Rwanda, His Excellency Paul Kagame. We are providing technical support to the Mech to establish the regional health financing hubs. In collaboration with partners, we are also implementing strategic interventions to support member states in improving private sector investments in health. These initiatives are rooted in Agenda 2063 and our dedication to fostering a healthier and more prosperous Africa. Looking ahead, we eagerly anticipate the Kigali high-level Health Financing Conference, which we are collaboratively convening with our EU sister agencies on the 2nd and 3rd of February next year. The high-level conference will aim to shaping the direction of health financing on the continent, and the conference will focus on three main areas. One, sustaining the HIV response, the roadmap to 2030. Two, financing and investing in the health sector, accelerating progress. And three, health security, advancing health product security through regional manufacturing. And this has been echoed yesterday and today. We must manufacture what we regulate. The Kigali High-Level Health Conference will continue to prepare better health outcomes. It is through these collective efforts and unwavering leadership that we shape the future of healthcare in Africa. As I close, leadership within the African Union system is not a responsibility, it is a commitment to the prosperity, well-being, and resilience of the African people. Together, and we echo Ambassador Brown's statement that we call upon you of Africa, the ministers here present, let us work together and declare this decade as the decade for health. I conclude by extending warm greetings from our CEO, Her Excellency, Mrs. Nados Bekele-Thomas. Thank you very much.
Thank you very much for your insights and your time, much appreciated. Now, ladies and gentlemen, it is my privilege to introduce our distinguished panelists who are really going to build on some of the things that we've heard, some of the insights that we have and our experiences as a continent. We want to talk a little bit about that in some depth, share some of the lessons that we've learned and some of the solutions that we have seen truly work based on our own experiences. So for the next 40 minutes, I would like to invite in conversation our distinguished panelists to please join me on stage when I call your name. His Excellency, Dr. Sabine Nsanzimana, Minister of Health for Rwanda. Her Excellency, Sylvia Masebo, Minister of Health of Zambia. Her Excellency, Professor Awa Marie Kolsek, Minister of State to the President of Senegal. His Excellency, Professor Khalid Ait Talib, Minister of Health of Morocco, Dr. Ngashi Ongongo, staff of Africa CDC. Thank you so much. Sage, sorry for the squeeze through here. I appreciate it very much. Thank you. Thank you very much. I'd like to start the conversation by asking, is there, oh no, do we have enough musical chairs here? I'm sorry, I guess I have to go there. Okay, there you go. Yeah. I always want to be part. Okay, let me start. Let me take the chair, I feel really. I'll sit over here. Thank you. Thank you. I'm going back there, Mike. Your Excellency, Sylvia Masebo, thank you so much for being such a wonderful host to all of us here in Zambia. It's my first time. I haven't made it to Victoria Falls. I was trying to, but I couldn't squeeze it in with the agenda, but I will. What more can be done to hold leaders accountable to the commitments that they make on public health?
Thank you. First, let me thank you for allowing me to be part of this high. First, let me thank you for allowing me to join my fellow dignitaries as this side event, as we focus on the transformative leadership that obviously is required for advancing public health in Africa. Our gathering here signifies a shared commitment to tackle the challenge, obstruct the health and well-being of our people across the continent. Africa indeed does face numerous health challenges. We recognize the pressing need to reshape our approach and drive transformative change to overcome these obstacles. And transformative leadership is not merely a concept, but a call to action, a call to reform our national plans, strategies, policies to create a healthier Africa for all. In the Zambian context, our transformative leadership agenda begins with the 8th development plan, which is for 2022 to 2026. And this plan is the Ministry of Health's National Strategic Plan for the same period, 2022 to 2026. And this is the plan that provides us with strategies to implement to deal with the challenges we face in the health sector. Now, the question is that how can we better drive these local investments for African-led? In Zambia, fostering local investments for African-led solution involves aligning the development plans with our health initiatives. I need to first say that we must embrace innovation, because innovation is the cornerstone of progress. We must leverage technology, embrace digital health, and support indigenous innovations which are tailored to our unique context. Having said this, here is how we can better drive our investments for African-led solution using Zambia as an example. First of all, in Zambia, we are pursuing economic diversification. Economic diversification from mining, agriculture, and tourism, which is our mainstay of the economy. And we are using this to fund health initiatives. We have to invest in local manufacturing, including medicines, as part of economic diversification. We have to promote a circular economy by repurposing funds which are generated from these sectors for health development. Apart from that, we have to channel funds which are generated from key sectors into the health sector. We are also establishing cooperatives to manage health-related services like ambulance operations profitably. We have to create cooperatives initiatives for job creation. In Zambia, the model we are using is the Constituency Development Fund, which is helping us in community health development. We have also to look at issues of local manufacturing for medicines. As we heard yesterday, even in Zambia, more than 90% of our drugs and medical supplies and equipment are imported. And so we are looking at building on existing local manufacturing capabilities in the health sector. We're also encouraging the growth of local pharmaceutical industries. And also we have to promote partnerships between the health sector and local manufacturers for sustainable development.
Excellent, excellent. If I may, microphone. If I may, you announced something pretty amazing yesterday. Zambia made a remarkable commitment to health, increasing your national budget. That you led from below 7% to 12%. And that's pretty amazing. How did you align everybody to make sure that got done and underscore the political will that was needed to dedicate that kind of a budget for Zambia? That was a big deal.
Well, we started by investing in economic sectors, and the resources that came out of the economic sectors are the resources that are being channeled to the social sector, which is health and education. And by the way, even our education sector now has been made free. So education is free in Zambia. And apart from that, a lot of investments also went, in the health sector. And I think one of the things also that we did is basically realigning how we spend the money that we generate in the economy by moving away from consumptive kind of expenses and just putting the money where it's best needed. And because of course, political leadership from His Excellency, he just made sure that from day one, he said there'll be no money in Lusaka, the money is going to the districts. And that's exactly what he did. He simply removed all the monies from the ministries in Lusaka and took the money to the councils. And we are basically deciding health functions from the center, local authorities, in an effort to have universal health coverage, and the entire primary health functions have also been moved to councils with matching resources.
That's the point about the political will and leadership. And let me ask the Minister of Health for Rwanda, His Excellency Zanzimana. Rwanda's been such a great example of political will and political leadership when it comes to pandemic prevention, preparedness, and response. We all know the effective strategies during COVID from Rwanda. So from your experiences, just share with us how individuals, regional institutions can all work together in order to strengthen pandemic preparedness responses across the continent. What would you say are the top lessons for us here? Like 3 lessons. You can't read a statement.
Thanks so much, moderator. Minister, thanks so much for hosting us in this beautiful city. And I think the preparedness, financing our health systems, and how we make sure that we work together and spend in the right place and on the right priorities is probably one of the most challenging decision to make in any context, being at the country level, being at regional levels. Why? Because there's so many competing priorities, and because there's so many actors that need to come together to decide whether you start with infectious disease or non-communicable diseases, or you build a system, it's a lab, it's a hospital, or you train people. See, there are so many things you have to put to a balance. And coming up examples is also equally difficult. But the most important thing is to have a clear vision on what you want to achieve that is cross-cutting. It's one sector, it's not just one disease. As I said before this morning, it has to start with building the foundations that everything else will come to a plug-in, such as health systems, as we say, people, for example, you're sure that they can deal with infectious disease, non-communicable disease, they can do research, they can treat people, they can be in different angles of the health sectors. So probably that is one area on the people. but also in the systems when you talk about infrastructure, health infrastructure, and also supply mechanisms that help everything to flow, being pandemic, being in a peacetime, or being in a normal health system with supply mechanisms. So probably these are the three things I can highlight, but this has to be covered by how we work together as countries and as regions. And this discussion, this conference here is an example of this is the third time we're meeting as public health in Africa. Someone could ask why only 3 times, why not 100 times? Could have had this many years back. But we have to catch up now, maybe to break some steps forward, so that next time we don't come back to say again another pandemic is taking us by surprise.
Thank you. I'd like to ask Her Excellency Professor Awa Marie Kolsek to weigh in here a little bit on leadership and women in the health space, because your leadership and advocacy has been inspiring to all of us here. And we know that when there are women in leadership positions, they're more likely to dedicate to important issues like health, education, and social issues. We've seen this in Zambia and elsewhere. The data's there, but women still face challenges. Women hold a small percentage of health leadership roles across the continent. So how do you see the unique contribution in shaping public health policy, and how can we get more women at the table?
Merci beaucoup. Je vais parler en français. Et donc, ceux qui veulent m'écouter n'ont pas à prendre. Starting by you. OK. Merci beaucoup de me permettre de répondre à cette question. Mais j'aurais préféré d'ailleurs qu'un homme soit à ma place. Parce qu'aujourd'hui, le combat de la femme dans des positions de leadership est un combat qu'on doit avoir entre nous, hommes et femmes, et ensemble. Et vous avez tout à fait raison, il y a un vrai problème de déséquilibre entre les hommes et les femmes quand on parle de leadership, et ça dans tous les domaines, et dans le monde entier. Ce n'est pas qu'un problème africain. Mais il faut dire que cela est lié à des préjugés qui sont déjà très ancrés, mais aussi au fait qu'il y a des biais qui sont liés au genre. Je peux vous dire que beaucoup de personnes pensent que les femmes sont très fragiles et ne sont pas confiantes, et donc elles peuvent difficilement prendre des positions de leadership. D'autres vous diront que les femmes ont en réalité beaucoup de poids sociaux et qu'on ne pourra jamais, disons, arriver à avoir des positions de leadership. Ce qui fait qu'avec tous ces préjugés, c'est normal qu'on soit dans cette situation. Mais ce que je voudrais dire aussi, c'est qu'en matière de santé, les femmes sont celles qui prennent en charge, que ce soit la prévention comme le traitement, dans les familles ou dans les structures sanitaires ou même dans les politiques au niveau communautaire. Qui s'occupe de l'enfant quand il est malade? Qui s'occupe de l'enfant quand il doit aller être vacciné? Qui s'occupe de l'enfant quand il doit gérer des problèmes de nutrition? Qui s'occupe de la famille malade et hospitalisée? Faites une photo d'un hôpital, vous verrez que les personnes qui sont au lit des malades sont pratiquement des femmes. Donc voilà tous ces problèmes-là qui font que les femmes sont beaucoup plus imprégnées des réalités et des problèmes réels de santé. C'est pour ça qu'il faut leur permettre d'arriver à ces positions de leadership. Je sais qu'en Afrique, il y a beaucoup d'efforts qui ont été faits. Il y a des lois, je prends des lois comme au Rwanda, au Sénégal, en Afrique du Sud, etc. Mais le problème n'est pas réglé. Et avec les femmes dans des positions de leadership, on pourrait régler des problèmes notamment de choix politiques. Bien sûr, elles penseraient tout de suite aux problèmes de mortalité maternelle, aux problèmes de family planning, aux problèmes de, etc., etc. Donc, les femmes seront beaucoup plus à même. Et je termine en disant que c'est la même chose dans la recherche et développement. C'est la même chose quand on parle de diplomatie. C'est la même chose quand on parle de choix. Et donc, cela permettrait d'avoir beaucoup plus de bons résultats et beaucoup de succès en matière de santé en Afrique et dans le monde. Merci.
And Excellency, how do you want to make that happen? How do you practically put in the driver's seat? Just a brief comment on that.
Happy use this question. Also, merci aussi pour cette question. Je voudrais dire que moi, je peux dire que mon défi et que je pense est relevé aujourd'hui, c'est les jeunes générations. C'est vrai qu'il faut permettre aux femmes aussi de pouvoir devenir beaucoup plus actives au plan économique. Elles le sont, mais dans des secteurs informels. Comment les aider? Comment leur donner des financements? C'est ça qui permettra aussi aux femmes de s'en sortir. Leur permettre d'être éduquées. Des mesures prises pour maintenir les femmes en milieu, les jeunes filles, cela est important. Quand on parle de familiale, quand on parle simplement de toilettes différentes entre les garçons et les filles, quand elles ont leurs règles, qu'elles puissent aller là où elles se sentent à l'aise. Des choses importantes qu'on peut faire sans beaucoup, qui permettent aux jeunes filles notamment de rester à l'école. Donc, pour moi, je pense que c'est la jeune génération qui va relever le défi. Nous avons fait ce qu'on a pu, mais ça va être concret avec les plus jeunes qui sont décomplexés, qui savent qu'elles ont la même capacité que les hommes, elles seront beaucoup plus efficaces et les hommes aussi comprendront ça beaucoup mieux. Merci beaucoup.
Thank you so much. And let's follow up on that a little bit with His Excellency Professor Khaled Aitab, the Minister of Health in Morocco, because you've been looking at an emphasis on fostering local investments, domestic financing for initiatives, for example. So tell us a little bit about the policies. Morocco has encouraged some of those things, including generally driving domestic investments in the health sector, driving local innovation, building gender lines.
Merci de m'avoir convié bien sûr à cette conférence. D'ailleurs, je voudrais remercier bien sûr Madame la ministre de Santé de Zambie de m'avoir pour l'hospitalité, pour l'accueil, aussi le CDC africain en l'égide de l'Union africaine de m'avoir associé bien sûr à cette conférence. À mon tour, je voudrais peut-être parler de la volonté politique qu'a le Maroc aujourd'hui. Certes, le Maroc, depuis le Covid, il a connu quand même un point d'inflexion. On a bien rapidement compris qu'il est temps aujourd'hui de parler de résilience et de souveraineté sanitaire au pays. La volonté royale était très forte. Elle était très forte de telle sorte à ce que, premièrement, il a parlé de 2 points. Premier point, c'est assurer une sécurité médicamenteuse. C'est la meilleure solution qui permet de riposter contre une nouvelle pandémie éventuellement. On ne sait pas s'il va y avoir ou non. Deuxième point, c'est comment, pour assurer cette sécurité médicamenteuse, il faut investir dans la production locale. Mais cet investissement dans la production locale nécessite un prérequis, c'est de revoir la charte d'investissement. Et d'ailleurs, dans la charte d'investissement, nous avons essayé d'inverser la balance. Plus d'investissement privé dans la santé que de public. Parce que généralement, le public dépense beaucoup d'argent dans la santé publique, mais sans impact important, réel. Maintenant, il y a une inversion de la balance de l'investissement privé au détriment du public, ce qui va donner plus de potentiel. Et en même temps, ça va créer encore plus de production. Au Maroc, je peux vous dire, l'exemple du Maroc, on a une production de 70% des besoins de médicaments aujourd'hui sont assurés. Il nous reste 30%. Mais c'est les 30% qui sont importants parce qu'aujourd'hui, il y a des progrès, une innovation thérapeutique qui reste encore plus chère et pour laquelle il faudrait peut-être faire encore un effort. Sa Majesté a voulu aussi pour la vaccination de créer quand même une usine de production. Et c'est la raison pour laquelle nous avons investi sur une usine de production qui a une portée continentale. Ce n'est pas une portée qui est internationale parce que le besoin en vaccin au Maroc, c'est 22 millions de doses de vaccins. Mais l'usine, il a un potentiel de produire très important. C'est pour cela aujourd'hui, nous sommes présents ici pour essayer de mettre en synergie notre potentiel et trouver quand même un marché commun d'intérêt qui pourrait quand même intéresser tout le monde, essayer de répondre bien sûr à un besoin précis. Mais ça nécessite aussi une synergie entre les différents politiques d'abord, aussi un travail de groupe technique pour essayer de reconnaître d'abord nos production, parce que si nous avons une agence de régulation des médicaments qui permet de reconnaître nos médicaments déjà à l'échelle continentale, on peut se partager bien sûr ce que nous produisons. Et le marché africain aujourd'hui, c'est un marché qui est très porteur. C'est demain le marché le plus important, 1,4 milliard d'habitants qui auront profité bien sûr de cette production. Et n'oublions pas encore qu'il y a le progrès. Et la médecine est en train de changer. Elle se personnalise. Il y a des biotechnologies, il faut créer un écosystème. Il ne suffit pas de produire un médicament, mais il faut créer tout un écosystème et qui débouche sur d'autres industries. C'est pour cela aujourd'hui nous avons besoin et nous sommes obligés de travailler la main dans la main et c'est bien sûr de briser ces barrières et nous sommes là aujourd'hui. Merci.
And in all of this, what cuts across is the digital transformation. It's becoming obviously front of mind, particularly in new innovations that we see around intelligent health and digitizing health in order to push forward the new public health order for Africa. I'd like Dr. Ngashi to talk a little bit about Africa CDC and digital technologies that you are thinking about, innovative ways that you are actually leveraging digital tools and data, potentially real-time insights to enhance disease surveillance and overall healthcare delivery more effectively. Just paint a picture for us.
Yeah, thank you very much, Zen, for the thanks to Honorable Minister hosting us. And I would like, first of all, to congratulate from the Director General of Africa CDC, who couldn't join us at this moment because of another emergency. Now, to your question, Zen, I think digital health is a game changer on the continent. So we feel what to say about the critical need of technology and digital. I think that's not only Zambia, it is the majority of our countries really on the continent advanced. I think Minister Rosman is here. I think Rwanda has been also really at the forefront of the digital transformation. It's because of that recognition, because as Africa CDC, our role is to respond to the needs of the countries. That's why we are there, is to support our member state. Because of that outcry, that clear need that has been identified, of the year, Africa CDC came up with the the Continental Digital Transformation Agenda. You know, that is our leadership role in terms of helping really set the continental agenda on digital health. In addition to that, I think we started out the best point to start is to hear from the countries what the needs are, what they are already doing. I think that's the reason why in October we convened in Rwanda, in Kigali, the Continental Health Tech Summit, which really brought all the countries and the key players in the area of digital technologies, that to hear already some of the things that they are doing, I think that are happening in different countries. Exciting stuff, you know, exciting stuff. Yesterday we had a session, I think the Minister of Health from Sierra Leone just shared the application to track every single pregnancy in Sierra Leone. You see that countries are moving very fast. That's what we have aligned as a continental agency. We are providing then the vision. We are also providing the convenient space for people to exchange. We are mobilizing the coalitions to be behind this, and we are mobilizing the resources that we can make available to the countries to move forward. Now, to finish, I would like to give two of very exciting initiatives that are coming in the area of digital space to build on what you are saying. This is building on the legacy of COVID-19. We had the public health wallet. I think there were at least 28 member states that are implementing that as a way of sharing information on COVID, both the COVID vaccination and the COVID testing. Now we are coming up with what we are calling the Universal Digital Health Wallet. That will give every African, you know, a card or an application that contains the electronic medical record that starts right from pregnancy. And then when kids are born, that is the information they can use for birth registration. when they start getting growing, that's the tool that takes information on immunization and everything that they get. When they go to school, that's the tool that they can get, all the record. And when there's an outbreak, as it was, that's the tool that we open it to take information on our travel movements, to link them, what you said, on the health electronic medical record on one side, but also on the surveillance. Because now when you come to the border of the country, they'll screen your card and see exactly where you have been, whether you have been tested or not. I think that is a tool that is really a game changer on the continent. The second is the primary healthcare digitalization agenda that CDC is carrying. I think you asked a question to Professor our colleague about some of the things that are being done to improve the leadership and the participation of women. We see in the primary healthcare agenda, we want to empower these women to be the ones that are driving the digitalization agenda. Empowerment in terms of the skills, it is empowerment also in terms of the job creation, if they're the one that contribute to the public health agenda on the continent. Exactly the same thing. We also want to understand, I think she said it very clearly, who provide the care? It is women. In community health today, we have 75% of the community health workers are women. What we want to do moving to this agenda of 2 million community health workers, all of them with digital gadgets, it again putting the digitalization in the hands of young women.
Thank you. We just have time for a final comment, actually. So please just note that I'm trying to keep everyone on time here in the room. And I would like everyone to think about what is the most important thing you would like everyone here listening in the room, as well as the tens of thousands we hope are also watching online. What is the key message you want to leave them with? I can't help but just go straight to Rwanda and talk a little bit about the digitization and intelligent health aspects, because there are many challenges there too when it comes to artificial intelligence that we're all seeing completely transform the world. If you could quickly comment on some of the things that we should think about for AI and public health, and then offer a final comment, and then we'll toss the panelists.
Thank you. And to understand the importance of digital transformation, especially in the health sector, we can try to bring ourselves back in 1999 or early 2000, when we didn't have any mobile phones and we were communicating through post and even emails were not there. So imagine that time and how it shifted from that period to today, a telephone becoming a necessity and everything happening in our hands. And then today, we can compare that with most advanced digital technology like artificial intelligence and big data and other things that some see today as something for the future, but yet is actually something for the past. If you look at how we needed it and how we need it more, especially on the African continent, we should embrace this technology, of course, within clear frameworks and laws and guidelines, so that it helps us where it has to be helping us, not just looking at the side of risks and problems. And what Africa CDC is doing, creating this digital wallet, is a good example what we should be having quickly. And to me, artificial intelligence is going to transform what we do in health in many sectors, being prevention, diagnosis, treatment, and other follow-ups and care, and how we really train people in our hospitals and our universities. And we should see that as another way to catch up quickly with what we lost in the last decades or more. So I think this is for young people to help us move faster, and for those who have been there before the technology to be open and help, and where digital tools is going to put us on another speed.
Your Excellency, Sylvia Masebo, what are your final thoughts for us to consider in the room today when it comes to how Zambia sees the future and the key aspects that underlie global public health, that leaders have to take action and demonstrate the political will?
I want to say that political will would definitely continue to be the key factor required for the health financing to be enhanced. And for Zambia, we have seen that in our Excellency, the President, who has taken the lead to ensure that health financing in the health sector is enhanced through the budget allocations. But also there are issues around policy that can also enhance financing. And we've seen that in Zambia here, the policy of decentralization, fiscal decentralization has also assisted in enhancing health financing. Apart from that, I think that it's important for the health leaders to also be able to work with other sectors, looking at factors that affect health. For example, for us here in Zambia, we have the Ministry of Water Supply and Sanitation, Ministry of Education, Ministry of Livestock. These are, and local government, of course, these are ministries that we are collaborating quite effectively to enhance financing in the health sector directly and also indirectly. But also, I think that the use of communities in itself does also help push health financing in a way, except that, of course, we need to ensure that we get community health workers that are skilled and that we pay well and that we make as part and parcel of.
Thank you. Her Excellency, Professor Awa Marie Kolsek, could you please give us a final thought?
On m'avait demandé de parler des femmes dans le leadership et je voudrais juste que tout le monde comprenne ici que si on veut que l'Afrique se développe, si on veut que l'Afrique s'en sorte, il faudrait aider et il faudrait travailler pour que les femmes soient dans ces positions de leadership, mais exercent leur leadership partout, que ce soit au niveau communautaire, au niveau national, au niveau international, et surtout les femmes africaines. Et je voudrais dire aussi que ça permettrait d'utiliser encore mieux l'innovation, cela a été dit tout à l'heure, parce qu'elles sont prêtes à cela aussi, mais également, quand on a parlé de manufacture et donc de production locale, eh ben, ça, c'est un point aussi important. C'est elles qui donnent les médicaments, c'est elles souvent qui vont les acheter. Elles comprennent notre problème. Je voudrais ici en profiter pour dire que nous avons le docteur Michel Sidibé, qui est au niveau de l'Union africaine, envoyé spécial pour les médicaments. Donc voilà des possibilités que nous avons et les femmes y penseront, les femmes le feront, mais nous devons travailler pour qu'il y ait cet équilibre homme-femme pour qu'elles puissent s'exprimer. Donc voilà ce que je voulais dire.
Thank you. Professor Khaled At-Talib, your final thought?
Merci, Madame la Présidente. Moi, je voudrais dire deux mots. Premièrement, il faut réduire les dépenses en santé en Afrique. Comment réduire les dépenses en santé en Afrique? C'est à travers la réduction des risques. On dépense beaucoup d'argent alors qu'on n'arrive pas encore à faire une réduction des risques. Et deuxièmement, il faut se projeter dans le futur. C'est avec la recherche et développement que nous pouvons prendre le raccourci. Parce qu'il n'est pas normal aujourd'hui que 2% seulement du budget qui est dédié à la recherche au niveau de l'Afrique. Ce n'est pas normal non plus que pour les essais vaccinaux, nous avons 3000 essais vaccinaux dans le monde, seulement 110 qui se passent en Afrique, alors que j'ai entendu chez le docteur Jean Casséa qui dit qu'il y a 2 écoles par semaine en Afrique. La recherche et le développement, c'est elle qui permettra, avec le potentiel humain et le capital humain de l'Afrique, de promouvoir et de se positionner et c'est de dessiner l'architecture de la santé en Afrique. Merci.
Thank you very much. Professor Dr. Ngashi, final word.
Yes, I think just to say that digital health is everybody's excitement, but the problem is that we have so many small projects that are being implemented everywhere. What we need now to see the impact is scale. That is my first message. And then for us to get that scale, then leadership is critical. Leadership, political leadership that Minister has just spoken about, but also technical leadership. Because sometimes partners don't go through the political leadership, they go straight to the implementing district and so on. And that's where also the fragmentation takes place. And lastly, is that this will not happen if the partners also are not well coordinated and also share the accountability for scale and impact for all of them to align behind the national leadership and the vision of the country on digital health.
Thank you very much. Ladies and gentlemen, please give a warm round of applause to our wonderful panelists and also to Zambia for being such wonderful hosts to all of us here in Lusaka. Thank you very much. We appreciate your time and we'll take a short break. Asante sana, as we say in Kenya. Thank you.
Recording stopped.
Connection that suggested. The one way that Up to Yep. Up. Check.